Let's start with healthcare. And the simplest question, we got this so many times, but I just picked one. Antonio on Twitter said, simply put, what's your plan for healthcare?
What is the plan for healthcare? To me, we're in the worst of all worlds right now with American healthcare, and it's like this crazy hodgepodge Frankenstein system that's gotten built on top of itself over and over again. Now, for people out there who like market-based solutions, healthcare is not the industry for you. It's like there are a lot of things in healthcare that just don't make any sense for marketplace competition. Right. I mean, just a short list is like you're not going to be an expert on everything. You become price insensitive, like as soon as it's you or your family member. Sometimes you're incapacitated and not able to make a proper choice.
Right. If you're sick, what would you not pay?
It's like very hard to comparison shop. So there are a lot of things to make it so that it's like, okay, this is not like some kind of like individual marketplace participant type situation. So first you get that out of the way. And then you say, okay, what's the current system? So the current system is we have this giant private insurance industry. And in part as a result of that, we're spending twice as much on healthcare as just about any other country. We're at 18% of GDP, which in like a $20 trillion economy, it's like 3.6 trillion. And it would be one thing if we were all remarkably healthy as a result of all this expense, but we are not. We underperform by very basic measurements like infant mortality and really, it's like you look that up, you're like, whoa. Some of that is due to the massive income inequalities and inequities. I mean, and that plays a role. But really, by any standard, we are not getting great value, bang for our buck.
Right.
And to me, the confusion around this is that people are like, oh, how are you going to pay for it? How are you going to pay for it? How can you afford it? How can you afford it? We are all paying for it. 18% of GDP again. Let's call it $4 trillion. We're all paying for it in ways big or small. And so if you happen to be employed while you're watching this and you have healthcare through your employer, then maybe you're like, ooh, my healthcare is free. It's like, of course it's not free because your employer is spending thousands of dollars a year on your healthcare and reducing your compensation accordingly. So if you were to have a choice, and this is because I employed young people. I was a young person once upon a time. So if you're at a situation where you're like, hey, I'm 25 and don't actually use the doctor all that much, and then your employer were to be like, hey, would you prefer some like sweet health insurance that you're likely never to use, or a little bit more money in your paycheck? Of course you'd take the money in your paycheck because you'd be like, well, let me save that and then just make sure if I get run over by a bus that I've got, healthcare. Like,
right, yeah,
that would be a win. And then your preferences shift when you're older, where it's like, please, please, please give me like gold-plated healthcare because I use it all the time. Would you prefer something? So there's like there are like shifting preferences over time that get completely obscured by the current system because you take the young person, which in a way is cool because you had to pool everyone's preferences and the rest of it. But the point I'm making is that if you think you're not paying for healthcare, you're paying for healthcare. Like you're paying for healthcare in terms of your paycheck. You're paying for healthcare in all of the prices that you ever encounter, because if you buy a good from a company, they're spending money on healthcare for their workers, and then they're pricing it accordingly. We're all paying the price because now all these companies are trying to push us all to gig, temp, or contract work because they don't want to give us health care because that's just the economic incentive. It's like,
what's the stat? You told me what percent of employers?
It's like 94% of new jobs are temp, gig, or contract jobs.
And then what percent of people get like health care from their employer today?
Right now it is approximately half. I believe it's 49% or 47% get their health care through their employer right now. So that gives you a sense of it. So if you think about all of those companies and all the money they're spending on healthcare, and then all of the impact on pricing and on your paycheck, and on healthcare costs if you interact with the system, it's essentially this giant hidden tax. And so when people say, how are you going to pay for it? How are you going to pay for it? It's like, well, look, if we take the same 18% of GDP that we're spending on healthcare and we shift it from businesses and families, where it is in large part right now, and then shift it to the public sector, that's not really like an expense.
Right.
Like that's like a transfer of money we're already spending within our families and businesses and on prices, and then you shift it to the public ledger, and then you can do all sorts of incredible things to negotiate for lower prices, negotiate for higher access. The tough truth is that we have so much waste in the system right now that we do have to go in and say, it's like, look, why is this ambulance ride $12,000? Why is this
Right.
prescription drug, like, $180 a month when, in Canada it's like $20 a month or
Yep.
whatever it is. Like there are all of these crazy excesses in the system because we built this like hodgepodge on top of each other. And I'm friends with a private investor who looked at it and said that she had never seen profiteering at a scale that she sees in the device companies, the drug companies, and private insurers. And she says it's so extreme that she's shorted the whole sector because she's like, there's no way this can continue. And she backed my campaign because she actually is offended by it as an American. She's like, there's like this incredible profit taking at the expense of the American people. Yeah, it's like we all pay for it in various ways. So this is a very long-winded preface of saying that the current system is incredibly expensive, not very effective, designed to make maximal revenue from us, regardless of whether or not it truly makes us healthy. And the most extreme example of this is when a drug company is like tweaking their drug in a way that adds absolutely no clinical benefit, but just enables them to retain the patent for longer, or like a new use. It's like it goes through years of a particular use and it's about to go generic, and then they're like, hey, we changed the formula. It does absolutely nothing, but it extends our, it's like the only reason you would do that is not to benefit a patient, it's just to benefit your bottom line. So there's this rampant excess in the system, and many very negative incentives attached to it. I just got a question today on Reddit as one example, which was those TV ads we see for drugs all the time.
Yeah.
It's like, oh wait, let's play act it. I'm gonna pretend or whatever.
Am I in
it's
this?
like, yeah, sure, you can
Okay,
get
cool.
it. All right. So it's like, Andrew's sad. Like, what has changed for Andrew? Maybe Andrew needs Reviva. And then there's like some picture of Andrew being like, oh, like now with Reviva, like things are better. And then there's a list of side effects being like, don't take Reviva if you walk on 2 legs, eat food,
It might kill you.
breathe oxygen.
You might bleed out.
Yeah,
your
side effects
orifices.
include like self-combustion, like like
Yeah, all of that.
like all the bad things. Be like, talk to your doctor if Reviva is right for you. So we all see these ads and we're like, okay, Reviva seems pretty terrible.
Well, it is a good question. Like, why are we doing this?
Why indeed? I mean,
Why
it's
are
just
we
for the
doing
bottom line. So, and who I've heard hates this is doctors, because doctors then get patients coming in their office being like, hey, heard about this Reviva? You know what I mean? It's like,
Yeah.
it's just shaping patient preferences. And of course, that's the whole purpose of the commercial.
Right.
Because the drug company's like, ooh, like if I can get you to, there probably is a Reviva. I just obviously made that name up, but there probably is a Reviva somewhere. Or maybe I'm gonna get like being like, cease and desist, Andrew. You're
We'll
insulting.
talk about Reviva.
You're insulting Reviva. And apparently, we are one of only 2 countries in the world that actually allows drug ads on TV. So this is an example of the kind of behavior that would go on that would help the drug company's bottom line. Is it helping the public? Well, if you think that, in theory, the doctor is supposed to actually see you, figure out what's wrong with you, and then decide on an appropriate course of treatment, which may include various drugs, and then your doctor actually is a professional that would understand what the drug options were. They probably have a whole suite of experiences with patients taking certain drugs. So in theory, there would be minimal clinical value to having me see a Reviva ad.
Yeah. What's up? Like,
So this is like a pinpoint, like a microcosm of this whole matrix of incentives that we have in our healthcare system that we need to change. And that, like, I'm prefacing this by saying, if we were to truly get in there and try and drain some of the excess, there would be lost revenue on the part of drug companies, device companies, and private insurance companies. Of course, because you have to know, it's like if we're getting charged twice as much for our healthcare as other countries, then you're going to have a lot of excesses. And then if you tried to rationalize those expenses, then you'd end up contracting many of those firms' bottom line. And that is appropriate, because at this point, it's more or less a hidden tax on us, families, businesses. We all live in fear of getting that healthcare bill. Medical bills are still the number one cause of bankruptcy for families. So you have to drain the excess. And the way, this is all a very, very long-winded way of saying the plan, is that we have a Medicare for all plan that essentially grants us all baseline healthcare coverage. Now, there are co-pays involved because you can't have people show up and have like zero skin in the game, but the co-pays are relatively nominal. Like affordable for just about any American, particularly after getting $1,000 a month. Show up and pay like a $30 copay. Totally fine, totally appropriate. So what we do is we take this massive expense structure and move it to the public ledger, and then the government can negotiate on behalf of tens of millions of us and say, hey, that blood pressure test, really inexpensive to administer. Instead of being $120, maybe it's more like $35. And then you try and drain the excess. Now, my Medicare for All plan does not eliminate private insurance in the way that some of the other candidates plan.
And a lot of people have asked that.
Yeah.
A lot of people. That's one of the biggest questions. Terry on Twitter said, wouldn't eliminating private insurance save the middle class more money? I can go down the list, right? But why do you want to keep it?
Well, so here's the thing: is like if we were to do it right, a lot of private insurers would go out of business because it makes no sense. Like if I had access to inexpensive healthcare or free healthcare, essentially, like free or near free healthcare, and then a private insurance company's like, hey, do you want to like pay hundreds of dollars a month for additional insurance? It's like, why am I paying for? Like, what am I paying for precisely? Right. But a lot of us aren't really paying that out of pocket. So here's where it gets interesting: is that if you're a company, all of a sudden your employees are covered by this public plan, and right now, if you're an employer, you're like, hey, here are your options. I'm going to pay for a proportion of it. And I've been in these shoes because I've been the CEO of a couple of companies now, and I very much remember spending all this money on insurance and then seeing the prices go up every year, and then having tough conversations with employees. Even though we were very generous, we'd cover like 80-90% of it. But then if you were to say, hey, look, your 10% just went up like a tiny bit, like, that's meaningful to employees. So if you're the company and you're like, you go to your employee and be like, hey, guess what? There's free healthcare. It's like out there, and you just go get it. I'm spending this much on your healthcare right now. You know what would do me a solid is if I don't have to pay for this healthcare for you, and you don't have to pay for this extra healthcare for you. And if you want, I can split the difference with you and give you some of the money in extra comp. And so would a lot of employees, if the Medicare for All was actually up to meet most people's basic needs, they would probably say, yeah, that works for me. And then you'd end up contracting the number of people that are using private insurance very, very quickly if we did a good enough job. To me, that it has to be the role of government to say, look, we can actually do a better, or at least cost-efficient job, and then actually restore a degree of discretion and competitiveness in private insurers. Because right now they're all just turning the dial and like ticking their prices up every single year.
Yeah.
That's their business model. It's like, has anyone ever gotten like a reduction in health insurance costs? It's one reason why it's breaking our back. I have a graph in my book, I believe, that's like, let's see if I can show it. Like, this is going to be a challenge, so this might be very dumb, but we're going to try. is that healthcare inflation is one of the main things that's breaking our
I'm laughing
back.
because I've seen you do this. Like, oh, let me show you in my book. I've seen you do this hundreds of times
Yeah.
to people in line when you're getting selfies.
Let's see if I can show it
You
to
found
people.
it?
I did. So here are like I'll see if I can do it. So there are like 3 lines. You can see it's probably not very visible. But the top line, the one that's the craziest increase is school cost. So that's university, and that's up 250% or so in let's call it a 25-year period. It's crazy. Then the next one is healthcare, and healthcare is up. It looks like it's annualized. It goes up from a base of 100 to 800 over looks like it's like a maybe 30-year period. So it's like 8x. And then the other line is other costs, which have been more or less static. So you can see that healthcare is one of the main sources of inflation because the business model of these companies is just to keep on ratcheting the prices up and up. So the plan, to summarize again, is Medicare for all, modest co-pays, but you have coverage, just one of those wonderful rights of citizenship. And then we shift the burden from businesses and families to the public sector that can then negotiate for lower prices. Do not get rid of private insurance. Right. And then private insurers would then have massive competitive pressures because they are essentially competing against this very, very low cost alternative. And then you would see them hopefully bring that curve down or frankly disappear. And a number of them would disappear. And that's appropriate. I mean, you can't have environments where essentially you get to jack up prices on Americans every single year. And I've talked to hundreds of Americans around the country whose backs are being broken by healthcare costs, prescription drug costs, people choosing between like drugs and rent and drugs and
right.
food and drugs and childcare. And the whole thing is immoral. It doesn't make any sense. We have one of the only systems in the world where it's somehow tied to employment. And tying your healthcare coverage to employment has so many negative effects. It makes it harder to change jobs. It makes it harder to start a company. It makes it harder for employers to actually treat you like a full-time worker. There's an economic term called job lock. And many, many people have job lock. How many people watching this right now have thought for a moment, oh, maybe I'll do something different, and then thought, oh, okay, because of healthcare. So if you have healthcare covered through the public, then it will add to so much dynamism and creativity and business formation, all these wonderful things in our economy. And the key challenge you have to accept is someone will be like, oh, where's the money? And be like, look, we're spending so much money now, we're just going to shift it from the businesses and families that are currently spending it to the government. And there'll be massive cost savings along the way. So that's the vision. It's Medicare for all, but don't get rid of private insurers and make it so that it's not like it's not even like a plan you have to buy into. It's just essentially
it's yours.
It's yours. And I've had family members return to parts of Asia and interact with the healthcare system, and it operates like that. They just show up and get a procedure, get a filling, get taken care of, and they walk out and are like, that was wonderful, seamless. It cost $40. Like the whole thing, they're just like scratching their heads being like, wow. And then you come to the US and it's a freaking bureaucratic maze, and everything is so expensive that you're like, ooh, good thing it's getting passed to the insurance company, but we're all paying the price. Yeah, we're all paying the price.
One of the things, and kind of taking away from a lot of the questions we got, was that you haven't talked a lot about healthcare on the debate stage.
Nope.
And I believe it's because a lot of the debate for the Democrats is around cost. And I think what you just said is that the cost-based debate doesn't make any sense because we have the money.
Well, I do want to dig into one thing, and this is controversial. But if you look at it, we're spending a ton of the money we're spending on the last 2 years of patient life. we're talking about, in some cases, like tens, hundreds of billions of dollars. So that I met with a guy named Dean Kamen. You were there for
part of it.
For part of it. So Dean told me this incredible story that really, and to me, encapsulates so much of what's going on in our system. So Dean Kamen is a freaking genius. He invented the Segway, is probably the most famous invention, but more meaningfully, he invented portable dialysis and this machine that enables you to essentially get dialysis in your own home. And right now, most people have to go to a dialysis center. As you imagine, there are, millions of diabetic Americans and people who need dialysis, and their quality of life in these dialysis centers is not great, not what you want it to be. You get hooked up, it's very debilitating. And so Dean has this machine that enables you to do dialysis at home, like improves your quality of life dramatically. And so you think, okay, people should be like doing cartwheels and like trying to do this, but they figured out that they don't make as much money if you're not in the center. Like the lost revenue is something like $100 billion nationwide. That would be lost because if you didn't have these very expensive, very miserable dialysis centers, then you'd be making less money.
Less money, yeah.
And so the lobbyists have fought portable dialysis tooth and nail, even though the data is incredibly positive and the quality of life is much higher. But people are like, no, you need to go to the center. And if you go to the center, it's not exactly like a joy.
Right.
It's the opposite of a joy. So this is an example of how like the money is driving the practice instead of our health driving the practice or quality of life driving the practice. And then, as usual in America, the lobbyists have control. So the lobbyists are making it so that portable dialysis is not the standard, and instead it's like get carted to these inpatient dialysis centers. And by the way, it costs us an extra $100 billion a year, like approximately. So this is an example of something where it's like you look around and being like, how the heck are we spending, $4 trillion a year? It's like things like that. It's like there's a way to save us billions and improve outcomes and improve quality of life. It's like, nope, can't do it. So it's things like that where you have to kind of break the stranglehold.
Right.
And if you succeed in that, so this is the kind of thing where the Democrats, in my opinion, are making a mistake by just like focusing on focusing on the cost is one thing.
Yeah.
And one reason why I haven't really gotten in on this is that obviously right now one of the key areas of contention for some of the front runners is their healthcare vision. So you have Bernie's Medicare for all, and then you have Senator Warren Elizabeth essentially saying like same thing, but with some different
ways to pay for it.
Different ways to pay for it that we're I'm I think going to see more of, and then Biden in another place, and so that's where the debate has been centered.
Right.
And no one thinks no one thinks of me and this campaign as like a healthcare driven campaign, and so it's not like it's like, hey, let's get the Yang plan in, but the Yang plan is to me the best of both worlds, and the key is to know that, and Bernie does say this, it's like we have tons of money in the system, it's just not being spent in ways that make us healthier or stronger. And then if you get caught in the cost conversation, it's like, look, we're already paying the price now. It's like if you get the healthcare off of our backs, then we end up saving that money that we would have otherwise spent. We end up getting better prices. We end up getting paid more. Like there are all of these things that, and this is to me like the role of the public sector, because you have this crazy bought and paid for labyrinth mess that is defying any sort of
right.
efficiencies or things that are going to make us stronger and healthier. It's just like you can almost imagine. I visualize it as like you're almost connected to this entire like patchwork of pipes that are like plugged into your body. You know what I mean? And it's and you have to try and.
Well, I think what's hard for people to get their head around, and I've seen it in some of my questions. You have a pro business but pro almost big government approach to that, right? Where it's the government needs to do more, but this would actually be fantastic for business.
Yeah, it'd be fantastic. It'd be fantastic for people. It would also be fantastic for individuals, because right now we are trapped in place by our current healthcare system.
Yeah.
And if we had confidence that we were going to get the care that we need when we need it. So part of it is, like, if you look at how we can rationalize the $4 trillion that's being spent. That if you have things like, hey, like, it looks like portable dialysis might save us $100 billion, but to dig into it, you'd have to take a hard look at the fact that we're spending hundreds of billions on extending patient lives by, like, the last 2 years, and in many cases those last 2 years are not exactly high quality of life years. They're not like,
right.
It's not like that person's like loving it,
Typically, yeah.
and of course, in some cases it's 100% what we should do. That, like, you can't just, like, have someone expire if you can save their lives or extend their lives and whatnot. But there are other cases where it's possible that the patient, him or herself, is like, look, I'm in pain, this is not how I would prefer to spend my last couple of years.
Right.
And right now the system actually is designed to try and, like, pour tons and tons of resources into that case, because the system does not care about that patient's preferences or the patient's health and well-being. The system just cares about trying to maximize revenue. And so if I'm an 89-year-old and you can make tons of money off of trying to keep me alive till I'm 91, then that's what you're going to do. If you came to me and said, hey, what would your preference be? Let's say I hypothetically was like, I'd rather spend, like, some time at home. And they'd say, hey, if you do that, you're probably going to die in, like, 3 months. And then I would be like, well, I'll accept that because I'm 89 and I'm, like, uncomfortable, like, with my illness or current condition or whatever it is. That if you have more Americans essentially be able to take greater degrees of control over how they'd want to spend that period of time, that's actually one of the major cost drivers in our healthcare system.
That's just the numbers.
Yeah, this is just the numbers.
Yeah.
And again, in some cases, of course, you want to spend every penny and try and extend that person's life because that's what they want, and, like, there could be a very positive outcome. And in other cases, if the patient is both, like, saying, like, hey, that's not what I want, and the outcome may not be, like, a return to perfect health, then we should be having different types of exchanges and conversations, instead of just saying, well, the system says let's plug them in and
right.
like, put them in, like, an intensive care that costs, like $1,000 a day, and then pass that bill to the public, because again, we all pay for it in our own ways. Like that, like these are not cost-free decisions.
Right.
And so if the patient says, that they'd prefer a different course of action, like, we should be able to, like, follow that patient's wishes.
Stuff that would be very difficult to talk on the debate stage, I imagine. It's a long.
Yeah, no,
story.
I mean, you can imagine a caricature of that. It's like Yang wants, like,
Right, yeah.
like,
I get it.
yeah, you get it. You get it.
I've got basically. I'm going to do a call actually in 7 minutes with someone dialing in, but in that 7 minutes, I wanted to do this question because I think you have really powerful answers on this. Sylvia said on our website, she said, I'm a person with health conditions and I worry about the prices of medications that keep me alive, like so many other Americans.
Yeah.
What are the changes that you pledge to make in the prescription drug system, and how soon could you actually do this as president? But I think that might be, that's why the second question, how we get things done. We have a lot of answers there, but let's start with the first part of that. What would you pledge to change on prescription drugs?
If you need the drugs, you should be able to get the drugs that you need without fear of going broke. And it's very doable because we're spending so much more on prescription drugs than any other country. I've got a 4-phase plan to get drug prices under control. Number one is saying to these companies that you have to charge something within international standards, because they often gouge us relative to what they charge other citizens in other countries, even though in many cases we subsidize the drug development.
Yep.
So number one is international standards. Number two is forced licensing if they don't adhere to those standards. Number three is public generic manufacturing facility. I mean, that's like such a club where it's like, oh my gosh, if they can just actually manufacture the drug.
Who's they? Like the
Like-
drug company?
Well, if you're the drug company, you're like, oh snap! If I gouge customers, too bad. Like then
The
there's
government
actually,
could manufacture it, a
the
generic
government-
version, very
yes.
quickly.
And then number four is importation, because in some cases there are alternatives in other markets that we could import in to compete. So there are ways to get the drug prices down, but under my healthcare plan, you should not have to worry about the cost getting ratcheted up and up and up. Like if you need the drugs, you'll have them.
When you changed, just out of curiosity, this happened to me. When I change insurance companies, I do the same prescription, but the price goes way up. And I'm even paying the same thing. It's just the actual cost of the exact same drug for out of pocket will change, and that's always the most infuriating thing in the world.
Yeah.
And you don't know until you've already bought the insurance.
Well, I mean, like all the pricing, and we all know, is totally opaque in
Yeah.
healthcare. It's like, and the truth is, they will charge very, very different rates for the exact same thing or drug or procedure for different people or in different areas or people in different plans. And the other thing is that there's like, even in expectations, they'll charge you some crazy amount, and then what they don't tell you is like they expect to only get a fraction of that, but because they would never tell you that. I mean, we all know there's some
We know
crazy
the
stuff.
system's
We
messed.
all know that the healthcare pricing is completely out of whack. It has no relationship to actual cost or reality. It's just their ability to extract maximum rents from us.